the part about urgent care that is great, but also not so great is the fact that most patients coming in, you have absolutely no idea what they're coming in for. So the sense that it is urgent is complicated to deal with, right? So, and especially during COVID times, it's been much more complicated because we certainly don't know what they're coming for, but we can pretty much guarantee that many are going to be COVID related. And so we have to take certain precautions for those as well. So, for me, the patient experience is incredibly important. The most important part is minimizing wait time, minimizing the exposure risk for those patients that are coming in and making sure that we are consistently delivering an exceptional experience. So we really focus a lot on making sure that our patients are very, very happy. Many of our patients have used us for many, many years and continue to do so. But along this time also, we're also getting exposed to patients that haven't come to us before. So it's their first offering of us, and we want to have an incredible experience for them. For me, I think the biggest focus is really just around, empathy and be able to have a friendly experience. It is also about timeliness of each of their visits. So we really focus on making sure that our team is completely accountable for having a wow experience for them, for those patients. And so from the beginning to the end, we make sure that they are constantly focused on the patient's needs. In order for us to do that, though, we have to free things off their plate. So, many providers, many doctors around the world wish they were getting paid, per click in the EMR. And so we try to eliminate as many of those opportunities as possible and make the provider experience really, really face focused rather than computer focused. So, we make it a very simple click, very simple thing here. We create a lot of templates and make sure that the process is as efficient as possible so that we can lay eyes on the patient, spend time with them, actually care for them while they're here. And so that's number one. Number two is we also really make sure that our patient is having a very simplistic experience, and that we don't try to make it overly complicated. We want to make sure that they come in, we take care of them, and it's not overly elaborate. And we're not going to have this massive EOB on the back end for them to look at and say, here are the 15 different charts that you have absolutely no idea about. And so we try to break it out in very simplistic terms for them so that they understand what we actually did. But also, we make it easy because no patient walks out with more than a $250 visit with us. And many of our surrounding organizations are charging a lot. And so it happens to be that we compete in a space where we think we can serve them at a very fixed rate and a very flat rate. And so that they know exactly what they're coming in for. They're not going to get a bunch of surprise bills on the back end. And then lastly, we put autonomy back into our team's hands. So, if the patient is not happy, we give them complete autonomy and complete authority to improve it and have service recovery. So that means that we have to refund them, have the provider call them. We literally let them do that at every team's will and discretion. So we really make sure that our teams are focused on, that experience, that moment. We may screw something up. We may not be perfect, but we really want to make sure that they deliver, a great service. And when we don't, we're going to make up for it. And we're going to do whatever we have to do to make sure the patient walks out happy.